Today I would like to talk to you about a patient of mine. She is an old lady of 82 years old, absolutely cute, and she comes to my clinic because since she has about 20 years old, she suffers from restless legs. What she feels is like difficulty to stay seated because of pain and a feeling of impatience in her legs. She says that it happens every time she stays seated, and it's even worse if the temperature is warm in outside or in the room where she's staying. And the other things she suffers from is a feeling of tension, anxiety. She worries a lot. She worries for her husband, for her children, for what's going to happen in the future, and that also makes her feel not peaceful and just enjoying the present moment. So that's the two things she would like we work on. And she, as an example, illustrating how much she's bothered by the restless leg. She says that it's been years she couldn't just watch a movie. She has to interrupt a movie and stand up, walk around a little bit, and then she can go back to the movie. And she has to do that several times. So going to the theater is, for example, just impossible for her at the moment. So my diagnosis was that this lady is suffering from something functional. I decided to make a diagnosis by the 5 elements because her emotion shows tension, which I can attribute to the element wood, and her legs also show tension. So my approach was a disharmony between the earth and the wood. In the pulse, her pulse was tight and a little bit rapid, slightly rapid, and also in the guan position, it was like bulging, which is like bulging, and also like when feeling like what I call a sticky pulse. Okay, when I teach about pulse, I call that a sticky pulse. So, and this lady was really wanting me to treat the two conditions because she felt it could be sometimes related. So in my diagnosis, I have the earth element with stomach and spleen meridian, and I also have the wood element with Sanjiao, pericardium, liver, and gallbladder. If you have never been to our class, you may be surprised that I mentioned Sanjiao and pericardium to be wood element and not fire. I suggest that you attend our class on 5 elements from Dr. Tan, and this is where we give you a detailed explanation on why pericardium and Sanjiao are wood element. So I decided to do a global balance, and in my step 2, I chose a mix of Jing Yang Ming and of Sanjiao, spleen, pericardium, and stomach. 2 4 meridian global balance patterns, but when we merge them, we end up with just 6 meridians because they have 2 meridians in common. And for my step 3, I decided to use meridian conversion. I wanted a bagua so I can address the emotional condition of the person as well as the property of the meridian, which is a 5 element property in this case. And I wanted to keep it simple with just meridian conversion, which is the most neutral bagua method. And then I needled the patient, and after the first treatment, she was very happy that she could stay in the chair and without feeling any symptom in her leg. She also felt like very, very relaxed. She said she almost fell asleep. And so she scheduled 2 more treatments. At the next treatment, it was 2 days after, she said that she didn't feel discomfort in her legs, only maybe one time for a very, very short time, something like 15 minutes, half an hour. But as soon as she stood up, the discomfort disappeared. And at the last the last treatment, so the third one, when she came in, she says that she was really super happy because it was the first time she could watch an entire movie of more than 2 hours with her partner, and she was so happy about it. And so after that, I treated her 2 more times, and the discomfort didn't come back. And the other thing is she feels much more peaceful and being able to live the present moment without projecting fears in the future. So I hope you like this case, and I will show you a little picture summary of everything I did.